Hello, I am Thaudam Carles, fourth-year medical student. Today we are going to do head and neck examination. Is that okay with you?
Yes.
Okay. Now we will start with examination of head. First, I will inspect the hair, like if there is any hair loss, and inspection of scalp, whether if there is any swelling, deformities. Yeah, palpate it. And after that, I am going to inspect the face, whether if there is any swelling, scars, deformities. And now I am going to palpate the sinuses. Now we are going to do the palpations of limb knot. First, we are going to palpate the post-auricular limb knot, pre-auricular limb knot, submandibular limb knot, submental, anterior cervical limb knot, posterior cervical limb knot, occipital, supraclavicular, infraclavicular. Now we are going to do the ear examination. First, we will inspect the outer ear or pinna for any deformities, scars, swelling. And then for inspection of right ear, we are going to use our right hand and hold the otoscope with thumb and index finger like this. And we have to pull the pinna upward, and backward, and gently put the otoscope inside it. And we are going to check the ear canal for any swelling, discharge. And after that, we are going to check the eardrum or tympanic membrane. Now we are going to rhinitis. I will put this on your ear, on the bone, and on the in the ear. Tell me which one is louder. This one is louder.
On the ear.
Okay. I will check the same on the other ear also. This one is louder.
On the ear.
Everything is normal. And after that, we are going to taste Weber taste. Please tell me, like, on which ear you are louder or the same.
It is the same on both sides.
Before starting the examination, make sure to wash your hand or sanitize your hand properly, and also make sure to clean your equipment. Okay, let's start with the inspections of the lips. Check for any angular stomatitis, which is in case of vitamin C or iron deficiency. Okay, please open your mouth. Do you feel any pain?
No.
Okay, please close your mouth. Okay, now we are going to proceed with vestibule checking examinations of vestibule of mouth. This is a part of the mouth in front of the teeth. Okay, I will examine. Check the vestibule of the mouth, buccal, mucosa. If there is any swelling, scar, check for orodental hygiene. Okay. And now we are going to proceed with examinations of oral cavity proper, which is the part of the mouth behind the teeth and in front of the oropharynx. Okay, please open your mouth wide open. Okay, see whether the tongue is in the midline or deviated towards left or right. Check for orodental hygiene. Retract tongue sidewise gently to see for any swelling. Okay. Can you please test your tongue at the hard palate? Okay. This is to check whether the patient has tongue tied or not, and there is no case of tongue tied for my patients. Okay. Okay. Now we are going to examine the tonsil. Please open your mouth wide open. Please don't protrude the tongue, and like just say ah. I will depress with my tongue depressor. And we are going to look at the posterior pharyngeal wall, tonsils, the movement of uvula, so palate, status of the posterior pharyngeal wall, to check for any granulations in case of granular pharyngitis, edema, redness, purulent discharge in case of chronic tonsillitis, and granulations or follicle or pus in case of acute tonsillitis. Okay, thank you. And make sure to do bimanual palpation in case if there is any masses in the patient's oral cavity. Thank you. Thank you. Well, we are going to do the visual acuity test. For that, please stand here. For the visual acuity test, first we are going to test the first eye test, and we are going to use Snell inserts, and we are going to make the patient stand 20 feet apart from the Snell insert. Can you place the letter from top to bottom, from large size to small size?
E, F, P, D, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C.
Okay, my patient is able to read up to 20 by 20. Now for the near vision test, we are going to use the Zeiger search and make the patient read the letters 14 inches away from the patient's eye. Please read from large to smaller size.
I think they seem to use the video on our nation class. Still with the hearty race of our range, we try to go to the vision and go to the only considered Europe secondly deserve the extent and level of Anthropology and Market of Somewhere. Send us to solve the topic of the lines in the level and the modern edition of the vision. Able to get the recipe for the standard and business that we take and dedicated process. This level is not about the vision and the educational program area that is very much more.
Zeiger tests include from J1 to J11, J1 being the smallest and J11 being the largest size. My patient was able to read until J1. Now we are going to do the gross examinations of eye. So first inspection. I will inspect the patient eye like eyelid, whether if there is any swellings, redness. Okay, and before I examine the sclera, I will sanitize my hand. Okay. Just look up, right, left, down. Okay. Up, right, left, down. Okay, now I am going to palpate your eyes. If you feel any discomfort or pain, please say it. Do you feel any discomfort or pain? No. Now moving to the next part, we are going to examine the pupillary examination. Please open your eyes properly. The pupil was able to constrict in the bright light, so we are going to test it in the dark light again. Please open your eyes. For the direct response test, the patient was able to constrict both the eyes. Let's move to the consensual response test. Please put your finger like this. Okay. For the consensual response test, when I flash one eye with the light, the other pupil also constrict. So now moving to the next test, we are going to test the swimming light test for the RAPD. Okay, my patient is RAPD negative because when I light the one eye with pen light, there is no dilation in the other eye. Now we are going to test the extraocular alignment examination. Please follow the tip of this pen. Now we are going to test the visual field examination. For that, please cover your one eye. Don't put pressure, just cover the one eye with your palm. Okay, please tell me the number of my fingers.
2, 3, 4, 2, 4, 5.
Okay, please cover the other eye.
2, 3, 4, 5, 5, 2.
Okay, please cover your one eye and look the other side into my eyes. And please tell me when you see my fingers.
I see. I see. I see. I see.
Okay, please cover the other eye. And please look the other eye into my eye.
See. I see. I see. I see.
The next test is tonometric test to check the intraocular pressure. Please close your eyes and look downward. Now I am going to use my two index fingers and palpate above the tarsal plate. Please say if you feel any pain or discomfort. Now we are going to test the fundoscopy examination. For this, the first test is red light reflex to see whether we have red light reflection in the patient's eye. Okay. For the further examination, we are going to see inside the eyes whether if there is any hemorrhage in the retina and others examinations. So for that, we are going to use like my right side of the eye and check the patient's right eye. Please open your right eye first. Okay, and now I am going to use my left eye to check the patient's left eye. Okay. Now we are going to perform breast examination. First, introduce yourself to the patient and ask the patient's name and other details to verify the patient. Make sure to ask for the patient consent before the examination. Firstly, inspection. Adequate inspection requires full exposure of the cyst. Inspect the breast and nipple while the patient is in sitting position. First, inspect when the arms are at the side. Inspect for the general appearance, including color of the skin, size and symmetry of the breast, and characteristic of the nipple, including size and shape. Next, inspect when the arms are over the head to bring out dimpling or retraction that may otherwise be invisible. Ask the patient to raise her hand over the head and then press her hand against her rib to contract pectoral muscles. Inspect the breast contour carefully in its position when the breasts are large and pendulous. It may be useful to have the patient lean forward, supported by the chair or examiner aid. Now, palpation. Palpation are best performed when the breast tissue is flattened and the patient is in supine position. Use the pad of second, third, and fourth fingers, keeping the fingers slightly flexed. It is important to be systematic. The vertical strip pattern is currently the best method for determining breast masses. Let's first start with the palpation of the lateral portion. To examine it, ask the patient to roll on the opposite side of the hip and placing her hand on the forehead, but keeping her shoulder pressed against the back or the examining table. This flattens the breast tissue. Now begin palpation in the axilla, moving in a straight line down the brow line, and then moves the finger medially and palpate in the vertical strip up to the base of the clavicle. Continue in a vertical overlapping strip until it reaches nipple. And follow the same similar step on the other side of the breast. Now, palpation of the medial portion of the breast. To examine the medial portion of the breast, ask the patient to lie with her shoulder pressed against the bed or examining table, placing her hand at her neck and lifting her elbow, which is even with her shoulder. Palpate in a straight line down the lip line, then back to the clavicle. Continue in a overlapping vertical strip to the mid-sternum. Follow the similar step procedure for the other side of the breast also. Palpate its nipple, notching its elasticity. If there is history of nipple discharge, try to determine its origin by compressing the areola with your index finger and place in a radial portion around the nipple. Watch for discharge expressed from any dug opening of the surface, not color, consistency, quantity of any discharge, and the exact location where it appears. Now we are going to do the abdominal examination. First, we are going to start with the inspection of abdomen for any deformities, scars, swelling, and after that, we are going to auscultate the abdomen. We should auscultate the fourth quadrant of the abdomen. After auscultation, we should do the percussion. We should percuss the fourth quadrant. And after percussion, we are going to palpate the abdomen. And ask the patient whether he feels any pain. Do you feel any pain?
No.
Now we are going to do the digital rectal examination. First, we need to lie the patient in left lateral position, and after that, we are going to inspect the outer area of the anus, whether if there is any swelling, scars, deformities. And after that, we are going to take lubricant at the tip of our hand, and we are going to insert inside the anal canal slowly and have to palpate the whole wall of the anal canal. We should palpate the prostate gland also, and after that we need to gently remove it and check for any discharge or blood.